Hello, good afternoon, everybody. I'm going live today with two people from the Agora. One is Anita, who is a senior embryologist there, as well as Michelle, who is operations manager, and we'll be talking about donor conception options, how third-party reproduction works, especially at the Agora, some very exciting news they've got coming up, and also from an embryologist point of view, how it works in terms of selecting a donor, what can happen once you've chosen your donor, and the process therein. So have all of your questions ready. I have sperm donor conceived children, so this is a topic extremely close to my heart, and I'm so excited to be speaking to their wonderful team today. The Agora are based in Brighton, in Sussex, and I'm going to invite them in. Hello to everyone who's joining. Nice to see you this afternoon. Hello, welcome. I've just given you a brief introduction, but please introduce yourselves for those who are joining.
Yes, lovely.
So, hi everyone, my name is Anita Chow. I'm one of the senior embryologists at the Agora, so please feel free to ask me any questions.
And my name is Michelle. I'm the operations manager at the clinic, but I also am the egg donation coordinator as well. So we do work hand in hand, dealing with egg and sperm donors and also recipients who are looking to use a donor as well.
Fantastic. We've got some great questions to cover today. If anyone has any questions live, this is what their wonderful team are here to answer. So please don't be afraid to ask. And you've also got some exciting news that I'm looking forward to you sharing. So make sure you're watching until the end so we can reveal what that is. The first thing I wanted to ask, so talking about genetics not being a requirement for Parenthood, we get lots of followers and readers asking about third-party reproduction, donor conception. I have 3 sperm donor conceived children as my husband's infertile. So it's really interesting to hear about the process in the UK, abroad, what you see with your patients. So I really wanted to find out a little bit more about the key questions patients have for your team when they come to the Agora looking to use a donor or may not know at the beginning that they need to use a donor.
So yeah, sure. So we do find it's more the process of actually selecting a donor that patients kind of need help with. Obviously we provide them with an initial and information sheet which details the banks that we work with and kind of the criteria that we're looking for when they go to select the sperm. That does help them a lot, but obviously we're always there at hand for them to ask any further questions. But most of it is the quality of the sperm that we're looking for, and because there are many different types of sperm out there that the donor banks do freeze, so we just help them to select which one they need and how many samples, and kind of how the process works once they've placed the order, and then obviously we liaise with the bank directly. So that's kind of the main questions really, is like which kind of samples to select, but obviously the most important is that they just need to be UK compliant.
And I know, Michelle, you're about to speak about the egg donor side, but just quickly on sperm donation. Lots of people do ask if they are HPV positive, does that mean that they should be selecting a donor who is, sorry, if they're negative, should they be selecting a donor who is also negative?
Is that CMV?
HPV. So exactly, yeah, because that actually happened to me and I was advised to select a donor who was negative. Is that something that patients ask a lot when they're selecting a donor?
Yeah, so is it HPV?
HPV, yeah. So I don't think we've had here many people ask about HPV, but I don't think that's because in the banks that's been kind of a key requirement. So one of the ones that we would see a lot of is CMV.
CMV,
that a lot of people do ask about, because it's so prevalent. So you've got, you know, so many donors who do come up positive.
So before it wasn't as much of a big kind of issue or subject, because patients could choose positive or negative CMV donors, but now it's more a requirement. If you choose a CMV positive donor, then usually we would ask them if they want to get tested themselves. And then their result, then obviously if they're positive it doesn't matter, but if they're negative then we give them the option to either choose again or they can use a positive donor, but we just make them aware of the risks involved.
Yeah, someone's just asked what is CMV, if you wouldn't mind explaining, please.
Okay.
Yeah, no, No, basically, CMV, it's part of the herpes family. So
Yeah.
The statistic is about 50% of the population actually have a past infection. So what we're looking for is if a donor firstly has a current infection and also a past infection. If they have a current infection, they wouldn't be allowed to donate at the time. If they've got a past infection, they can donate. But the key thing is really understanding if, you know, you're happy to take the and usually, you know, theoretical risk. Certainly with egg donors, it tends to be a theoretical risk. Sort of, I think, bearing in mind the whole picture of what you're looking for in a donor, because I know I certainly see a lot of recipients who are trying to find that perfect donor, and you know, another thing to throw into the mix of getting that right and matching that does make that process really, really difficult. A lot of people, they do have to think about that and whether it is the right decision for them. And I usually, certainly for people who are on my egg donation waiting list, I do have that discussion with them at an early stage so that they can potentially get a test done and see if they have a positive or negative result, so that they can make that decision about the sort of donor they're looking for before.
Yeah, absolutely. And that's exactly, I think it was just a different sort of acronym that was used previously when I was looking. That's exactly what I was referring to. So thank you so much for answering that. That's super helpful. What are the other questions that you get asked or considerations when people are searching for a sperm or egg donor?
I know from my perspective, when I'm dealing with recipients looking for egg donation, because I'll discuss this probably a little bit later, but we do have a couple of different options for finding the right egg donor, and that can be in the UK or that can be abroad sometimes. And one of the key things is about the anonymity of donors, for example. So in the UK, all donors do have to be essentially traceable. So they're anonymous to you, but they are registered to the HFEA, which means that any child born through a donation is able to, when they turn 18, access identifiable information about that donor. Whereas in some places abroad, that isn't always the case. And that is sometimes a difficult decision for people, because even though the waiting time might be shorter to go abroad, it's an important aspect to consider for your future child. So I'd say that's one of the key things that I certainly get asked on my list. I don't know if you get any key ones.
So the main thing was CMV really, and quality of sperm to select. Another sometimes I can come across this, because obviously the banks do screen the donors with a lot of genetics these days. We try and advise patients to ideally choose a donor that doesn't have any genetic issues or mutations, because it will mean they will have to get tested themselves before we would allow them to use it, which obviously financially, time-wise, will be obviously more. But we then do say, obviously, that then does limit their choice, which they obviously do sometimes mention to us about. But we do tell them, it is possible to find one without a genetic mutation, because we have many patients who manage to get samples, and we do work with at least 5 banks, so hopefully they'll be able to find one from there.
Yeah, so there's a good amount of choice. That happened to me actually, that the donor that we originally selected, we needed to select again due to genetic reasons. I know that doesn't happen every day, but what happens if you have patients who do need to choose an alternative donor?
Actually, I was about to mention, we do now offer a package where they can basically we can offer counselling, and then we work with geneticists who will then look at the actual disorder and work out what the risk factor is, and whether they should be tested or not. And then they can actually, the patients themselves can be tested for it as well. And then if they're tested clear, or if they are carrier of it as well, then they can make a decision if they were to use that sample or not.
It's amazing that you offer that sort of 360 support, because obviously it puts people's minds more at rest, and before they go into something that's obviously big. But also when you do decide on a donor, having done it, you strangely feel attached to that donor before anything's even happened, because the process to get to that point is so emotionally it can be quite emotionally difficult, and there are so many deciding factors. And as you said, once you've narrowed down a search, you may not find as many as you thought you might. So I can completely understand how people might want to stick with a donor and explore you know, what risks there might be. I guess because we've had people saying before, well, you know, if you were having a child with a partner, for example, there are some things that you wouldn't necessarily know about at all.
Yeah, it's one of those things, and I think sometimes being more aware, you know, can make that decision so much more difficult. And there's a, you know, an ease to ignorance bliss, if that makes sense. So I think when it comes to the genetic aspect is that normally, you know, if a patient does still want to go with the donor, we advise them obviously to go down the genetic testing route, so that we can, you know, really be much more confident that the risk is significantly low. And then if a patient actually is also a carrier of that condition, they have to choose another donor. We will then support them in finding a new donor that's right for them, and actually kind of guiding them through that process, because as you say, once you're attached, it's very, very difficult to kind of start that process again.
I think as well, it's kind of like you feel, or I felt like a weight had lifted off my shoulders having made that decision. So then to be thrown into making that decision again, just you want to sort of, you want to move on, and you want to start you want to start the process.
Start treatment, as like most patients do say, and then kind of like a setback really once, when we like look at the sample and be like, oh, actually, like, you know, you haven't accounted for X, Y, and Z, and exactly. So, I mean, I know how long is a piece of string, but when your patients are looking at donor conception, what's normally the time frame?
I suppose it can be a little bit different. I think it might be worth speaking about choosing like sperm donor and going through that process, a known donor, or maybe going to a bank. You want to start with that?
Yeah, so obviously if it's from the bank, obviously the main thing is how it actually takes the patient to actually look for the sample. But once they've found the sample, and we accept the sample, it's usually with us within like 1 to 2 weeks. So maybe from the beginning to the end, maybe possible in a month, maybe.
Wow.
Yeah. It's certainly possible to
be as quick as that.
And you know, it completely depends on the person, because we've had some people who have found the right donor quite quickly, and we've had some patients who've gone to banks and they've just not found the right donor for them, and they've kind of waited a bit longer, because that's the other thing is the donors do come and go off of banks depending on availability and things like that. And with known sperm donors, so you can obviously have the option to have a known donor come with you. That process is a bit longer simply because of the screening process. What's the total length of time?
So basically they have to be screened before, and then after they freeze, the sample needs to be quarantined for 3 months, and then they can use it after that. So maybe you're looking at about 4 months before you use a sample with a known donor.
Yeah, that makes sense. And do you advise at the Agora on how many vials or straws someone using sperm donor
would need?
Get, because it can be really unknown, can't it, as to how many vials you might need per round of treatment?
So what we'd usually advise to patients is, as long as they follow our criteria, which we ask them to select when choosing sperm. So there's a certain quality we ask for, which should be suitable for IUI and IVF. Usually we say 1 sample should be sufficient for 1 treatment cycle, providing it meets those criteria. Sometimes they may find a donor that don't quite meet the criteria, but it might be just slightly lower criteria, in which case we may say we might need 2 samples as opposed to 1 for 1 treatment, and we would advise them how many to order. But we also always say always order 1 as a backup, just if it doesn't thaw out well, but also if they are planning to come through for multiple treatments, or if their partner as well was planning on using that sample, then we would definitely tell them to order at least 3. Goes on shipping as well, because each time they ship, that's another cost there as well. Yeah,
absolutely. I think that was one of the questions that I had, which is considerations if you might want to have more than 1 child.
I think often, you know, going down the route of using a sperm donor, hopefully in most circumstances you will have the choice of purchasing more than 1 vial, etc. Obviously going down the egg donation route, that isn't always the case. I mean, we certainly here do have a few different options. So one of the sort of most common options that a lot of our patients will have is they'll be the recipient of what we call an egg sharer. So that is someone who is coming through for their own treatment, and they are donating half of the eggs that are collected anonymously to someone else. we do guarantee a minimum of 4 eggs to be donated for the donation to be, you know, successfully achieved, essentially. But obviously, the chance of having siblings is certainly reduced with that sort of process. So we do often tell our patients, you know, if they are thinking about trying to sort of plan for siblings, they may prefer to wait a bit longer and be matched to, for example, a donor who's donating all of the eggs to them. So the main difference is that that timescale usually takes a little bit longer to sort of find that donor who we can have more of. But actually that brings us on nicely to say that we do have the 2 options there, but also we are starting our own egg bank as well, which is very
exciting.
Now. And that,
are you able to reveal the name of that?
Yes. So we're very, very excited to say that we are opening Brighton Egg Bank and Brighton Sperm Bank.
Amazing.
So yeah, it's very, very exciting to be able to offer that because, as we know, so many of our patients do need sort of different donors, and we want to try and give our patients a little bit more choice, so they can still go and use a bank abroad, etc. But you know, having the option here as well just expands those choices of finding the right donor for them.
Absolutely, I think that's amazing. I can't wait to hear more. And so that brings us on to talking about the ability to use frozen eggs as well.
Yes, yeah. So the main difference that we advise patients is that if you are using frozen donor eggs, you do have to do ICSI. So for those who aren't aware, so ICSI is where you are injecting the sperm directly into the eggs. So it is a slightly different process. And in terms of sort of thaw and survival rate, you know, we are only freezing mature eggs, so that is the key difference really. And usually when we're freezing eggs, our donor eggs, we freeze them in batches. So you might sort of try and sort of get 4 eggs or 6 eggs, for example, from a donor, and you could potentially get more than that, sort of depending on how that works. So all of the donors that will come through with us, we will freeze those in batches, and depending on the availability of what the donor eggs have, patients will be able to have those discussions about what they would like to have. And again, that discussion about siblings is really important at that stage as well, because if they want the same donor, they might want sort of create time or reserve them, etc. So.
And for egg donation, I know it just completely depends on the egg donor, but what's the sort of range of eggs you might expect to get from one batch of eggs?
Yeah, so if we're looking at, for example, a fresh cycle with a donor, we do have, you know, it can really depend on the donors that are coming through, but we do set quite sort of high criteria for a lot of our donors. So normally I would say the average is somewhere between sort of 12 to 16 eggs is usually what we can expect to collect from a good donor. Sometimes it can go a little bit above that, because sometimes it can fall a little bit below that. One of the key things that we believe here is quality over quantity. So what we do when we are stimulating the ovaries of someone who is donating, we're not necessarily giving them the highest amount of stim. We're giving them what the doctors have considered to be a very healthy amount, because we would ideally like those eggs to be of maturity enough to be able to be frozen as well, if that is an option, and also to be of a good quality to give you the best chance at an outcome. So for us, that has kind of been the key thing for that. And also I think it's really important that our donors are really looked after and aren't made to feel very unwell and things like that. As many people know who've gone through the IVF process, that you generally quite bloated and unwell afterwards. And again, that's quite important for us to sort of consider the benefits to the recipient as well as to the donor as well.
Yeah, that makes complete sense. And what if someone was to get say 13 eggs from an egg donor, what sort of percentage might end in a successful pregnancy from that?
So our donor success rates with egg donors is around sort of 56% per embryo that is transferred at the moment. So yeah, definitely above 50%. And obviously the age of the donor does come into play, and this is something that I wanted to bring up, is that in the UK, all donors are needing to be altruistic donors. So that means they are doing it completely for, you know, the really lovely reasons that would come forward for, and so they are just sort of compensated really for that time. And for that reason, we often don't get as many super young donors, which we believe is a very good thing in terms of ensuring that the whole donation process is very, very smooth. But you can potentially see, and sometimes abroad, you can see that success rates can be a little bit higher. And that might be that they have donors who are very, very, very young, but there's not quite as much certainty that they're doing it for the altruistic reasons. So there's drawbacks as well from that perspective. But this is that we also make sure that our donors do have a lot of sort of fertility testing at the start that's very good, and will also indicate if they've had any sort of successful pregnancies in the past, including successful donations in the past as well.
And for sperm donation and egg donation, do you find, or do you see that in the UK, hence you giving people more options, there is a smaller pool of donors because the donors have to be open so they can be contacted when the child is 18?
Yeah, I definitely find, obviously since they introduced that law as well, definitely there's been a decline. I mean, you can see in the, like, for example, in some of the sperm banks like up in London, like, you can definitely see a decline in their number of donors that they have. So definitely that is a factor. But however, saying that, since we have just started the process, we're just starting to recruit actually. We have had quite a good number of uptake, but obviously those that end up donating, obviously it does reduce as it goes along. So
I want to find out a bit more about that. How many people end up becoming a donor? What's the criteria for selection?
So the criteria is quite strict, unfortunately. So obviously age comes into concern, and then obviously we need to do screening on them. We will need to obviously do an analysis, most important, to see if their sperm is sufficient to be donated. And then obviously then I need to undergo counselling and have consultations. So
medical history check as well.
So it is quite a long process, but if they manage to get through all that and all is okay and they're still happy to donate after all of that, then I mean, for example, from maybe say from 10, you might only really end up with 1 or 2 that will.
Yeah, absolutely. And I think the counselling part is really key to that, isn't it? Because the steps that they have to take to go through the scenarios that may play out in the future, because obviously you ultimately want a donor who isn't going to change their mind in the future, and as you said, is doing it for the right reasons.
Yeah, I mean, certainly just to sort of reassure people is that I've certainly had a lot of discussions with potential donors who are, you know, obviously donating their eggs, and one of the key conversations we have very early on is having that discussion about implications and how, you know, how would you feel if this, and I think because of the law change, and also because of the fact that realistically they're not compensated very large amounts, I think that those donors actually are really doing it for the right reasons, and therefore are much more likely to not withdraw their consent. Something that I think is really, really a good thing that we have got in the UK. And I think it gives a lot of recipients that reassurance that their donors are, you know, really lovely people and things like that. So I think that that's a significant thing. And so in terms of the process that we have is, yes, we do all the initial sort of fertility screening and consultation, etc. And then we do the implications counselling, because it's given them a chance to kind of get a feel about what that process is going to look like before they've had that full discussion. And that full discussion, we do see a drop off at that stage, because some people, you know, it does start to sink in about some of those implications. I think it's a really important conversation to have, because if anyone's got any doubts,
better now than in the future.
Exactly. But we do have a lot of people who come to us and donate maybe after they've completed their family, for example. So, you know, it obviously does depend, but it's usually out of very, very lovely reasons that they're wanting to help someone else, or maybe their best friend has gone through this sort of process. You know, I think there's a lot of positives there as well.
Well, having donor conceived children, like, you know, we're so grateful to our donor. It's the most incredible gift someone can give. And I presume that that decision might be more challenging for women, because it's more of a process to go through, isn't it? Like physically than taking a sperm sample.
Yes, absolutely. And, you know, I would say a lot of donors, it's about sort of saying, you know, are you ready to go through a process that not only has obviously those implications, but also, you know, is very sort of emotionally and physically quite a challenging process. And actually, I think the ones that do go through that process, they are, you know, so happy with the reward they get from having done something amazing at the end of it. They're willing to do that for someone. And I think, again, that's an incredible thing. And actually, even from a sperm donation perspective, they have a lot of appointments with us, and it is a lengthy process still. So usually the ones who are going on and doing that donation, again, are in that same mindset. So, yeah.
you see, being based in Brighton, you see a lot of people coming in who are same-sex or doing it solo, and all sorts of routes to parenthood, don't you? So to offer that support with the Sperm and Egg Bank that you're introducing is fantastic. So I'm sure that patients currently and to be will be very reassured and pleased with that addition. So that's brilliant news. And I wanted to ask, we've spoken a bit about that. Is there anything else that people should note when they're having donor conception treatment at the Agora, in terms of considerations, in terms of something that they may not have thought about?
I think on that note, I think one of the things we ask all of our patients to have is implications counselling themselves, because for some people they might go into this process and know that they're going to be using a donor, but others might start this process and then find out that they need a donor. And obviously for both of those scenarios, I think there are a lot of things that people don't automatically think about, because again, it's not something that people discuss necessarily openly in society. And so those conversations are kind of not thought about at all. And we work with two brilliant counsellors who are really good at kind of speaking through those processes. And we do encourage people, if they have any niggles or uncertainties, they may wish to have a second session in the future, really to go through some of the things that are potentially slightly bothering them about that process, and just getting that clarity that they need. And obviously we're here to support them as well. And that's why we always say, Anita is one of our embryology team. We do have a whole team who are there on the phone, ready to answer those questions about using a sperm donor and choosing the right bank, etc. And again, on my side, I've got a lovely egg donation team who work alongside me, and we are all there to answer those questions that people have, because they do come up along the process. And everyone's story is obviously unique as to how they're going to get to the process of starting their treatment. We want to be there, obviously, to handhold everyone. But definitely.
Well, I know the patient care is phenomenal at the Agora. So for anyone who's interested in general treatment or third-party reproduction, please do follow the Agora, DM them, DM us. We can put you in touch happily. The other thing I was going to note was, I remember I did an interview with Dr. Jonathan Ramsey and Dr. Carol Gilling-Smith, who's, of course, your medical director. And I know that he works with you, doesn't he, to do male surgeries at the Agora. And both of them agreed that if someone gets the result that they weren't expecting from, whether it's the microtesty operation or female testing has revealed that donor eggs might be used, or vice versa with donor sperm, to take that time and to really consider options and what you want to do, rather than not rushing into it, but rather than feeling like that is what you must do next, if that makes sense, because it is such a considered process and there is so much support available psychologically to make that decision.
Yeah, and it's not, in that sort of scenario, it's not a quick process at all. And I think a lot of people get really worried about this whole time thing and doing things, tomorrow. But actually, I think for your own success, your own welfare, it's really, really important to take that time, consider your own needs, and actually put your needs first, and then start this process when you feel that you're ready to do that. Because, the last thing that you want to do is go into something and have that panic just before you're about to start your treatment. And that's the last time that you want to start having those sorts of thoughts. So getting the support in early and talking through any worries or concerns you have is so important, and by far the best advice I would give to anyone who's kind of starting that sort of process.
Absolutely, I think that's completely sound advice. Anyone who does have questions, please reach out to the team or message us, as we've just mentioned. Thank you both for your time today. Is there anything else you think that might be important to cover on this topic?
I think we've probably covered a lot of the main bits, but obviously everyone's got their own questions, so we're here to answer questions all day, every day. So please.
I was going to ask one more question, which you probably do get a fair amount, and that's on the egg donation side. What's the cap in terms of age of an egg donor recipient?
So an egg donor recipient, the cap for that would be at 50 years. So essentially until your 51st birthday is where we generally cap it. What we would normally do is with anyone who is perimenopausal or menopausal, we would usually have a discussion, the doctor would have that discussion about ensuring that they are in, you know, a good position to sort of be going ahead with their treatment, and just actually ensuring that, you know, they have everything in place in case they have anything in their medical history that we should be taking note of before starting it. That's really, really important. For example, maybe we have a lot of ladies who might be on HRT already. And again, just making sure that they've got the right plan in place for them. We always make everything individualized. So our doctors are very, very good at discussing that. But a lot of our ladies have concerns about them being in, you know, over 45, for example. But from our perspective, actually going through a cycle is really not a problem. We don't have any issues in terms of getting that lining to the point that we want it to, because we're not worrying about the ovaries at all. And a lot of people sort of think, oh, well, you know, I'm over this age, so therefore surely all of my body's not going to be doing as it should. But actually, amazingly, the uterus, even past menopause, can do exactly what we need it to be able to hold a pregnancy very, very well and not have any complications at all. So just say, speak to your clinician about any worries or concerns you have, and yeah, they'll guide you through that process.
And someone just asked, what's the age limit for an egg donor?
So age limit for an egg donor is up to the age of 35. So most of our donors will be at least starting that process kind of sort of well before they're turning 36, really. And I would say the average age of our donors does really, really vary, but usually it's kind of late 20s, early 30s is kind of an average age. Some that are on the younger side, but we get a lot of ladies who actually, like I said before, they've had families potentially before they want to sort of do their donation as well.
Yeah. Amazing. That's been so helpful. Thank you both so much for your time. And thanks to everyone for joining.
Yes, thank you so much.
Bye-bye. Have a good evening. Bye-bye.
Bye.